back to the Retreats YouTube channel. I'm here with three familiar faces. I'm here with Antipas, George, and Thuku. They work as the head of departments at our different branches, Antipas in Ngong, George in Limuru Main, and Thuku in Limuru Annex. Last time we talked about addiction and learned about it being a disease, how it doesn't just start because someone has used it one time. There are different risk factors that come into play before someone gets to that point of addiction. But the question that we're asking today is, are there certain professions where there's a greater risk of someone becoming or addicted to a substance?
So Stella, that is a very tricky question because we might remind our viewers in our previous discussion. First, we mentioned that addiction does not discriminate. That means that regardless of your profession, regardless of your social status, regardless of your background, everyone is at a risk of developing addiction. However, now when you are looking at the risk factors, there are some social or environmental factors that might predispose certain people to addiction. For example, when you look at certain professions, depending on the duties that you are performing, depending on how your job is, at certain points we might see certain patterns of addiction in certain professions. However, now usually the reason why this conversation is a bit tricky, when you look at the broader media, there are certain professions that will be actually given more attention. For example, a doctor who is having an addiction, people will actually get more attention from that case. If you have police officers who are supposed to take care of people and they are in active addiction, there will be some certain attention in that profession. But when you look at it as a whole, when you look at the broader clinical literature, there is nothing that actually says that there are certain professions that will have more people with addiction than the general public. Yeah.
Okay, that's interesting.
I think my colleague has talked about predisposition, and if I may take a profession like the uniformed or the disciplined forces, you find because of the nature of what they do, they may be at a greater risk, and that is what we are calling predisposition. You look at the nature of their duties. If there's a robbery or there are matters, terrorism or whatnot, there are shootouts. If someone has died somewhere, there are the people to be called in. They know the procedures that they follow. If someone is injured and their relatives are not aware, they are the people who will take up the role, take the person to the hospital. Sometimes they will call in an ambulance, and that is where we talk about the medical professionals. Also, part of first responders could be the media. They rush to the scene to report. They can also get traumatized by what they see. Back to the disciplined forces. Sometimes they are fighting the drugs themselves. If someone is at risk of addiction and you are told watu wanapika chang'aa mahali, nyinyi ndio mnatumwa go check what is happening. So if you have that predisposition to addiction and you're being sent as part of your duty, then you will be inclined toward maybe that risk of using the substance. And we've had cases whereby even some of those exhibits will disappear.
And perhaps even to add on that, when you're talking about these patterns in different professions, when you look at certain professions, they have more access to certain types of substances. For example, the people in the healthcare profession, they have more access to prescription medications. And when you look at now in terms of the addictions of prescription medications, they are at a higher risk of developing those types of addiction. When you look at also people who work long shifts of hours, that they are required to be concentrating during that whole time, they are at a higher risk of developing addiction to stimulants because they require to be active for a very long period of time. So these are the patterns that we say that they will be recognized in certain professions, perhaps not in other professions. So there are certain patterns you can recognize in one profession that you might not recognize in others.
I think that's very interesting, the fact that certain patterns would be very present and very loud in certain professions, but not be in others. Or even accessibility to substances. We don't really think about how easy it is to access certain substances in certain professions. But now looking at it as everyone is at risk, in spite or despite your profession, is there something we can do to ensure it doesn't get to that point where we are able to be more proactive rather than reactive? Isikuwe tunatarajia mtu afike hiyo kiwango ameingia kwa addiction ndio sasa tumkimbize rehab ama tumkimbize hospitali for detox. Is there something we can do before that, Fuku?
Thank you, Stella. One of the things as an individual or as a professional that we can do is to do what we call self-care. And self-care is a large component that includes having a work-life balance so that you don't end up working so hard without breaks. This way it is important for you to have regular breaks. It is important to have a quality sleep, eating well, minimizing the use of substances, and ensuring that once in a while you just disengage from the work environment and you give your mind time to reflect and your body time to rest. In that case, you have minimized the risk to now having the work-related issues affecting your functioning. So it is important to take care of oneself. Yes.
Now, I'm just thinking of those people who might not be able to get time off of work, or they work in again, those shifts where they're not able to take that long break or even a short break to calm their own minds. Are there things they can be doing in the office or in the workplace? Are there exercises that they could try to calm their own minds down?
Of course, there's something we also call mindfulness, whereby it is important for you to actually look at yourself as an important element of the workplace. At the end of the day, remember that if today you as a professional, you do not function well, most probably the organization is going to replace you. So it's good to remember, in as much as you are really working hard and ensuring you meet your targets, it's also good to take measured analysis of yourself and asking yourself, where am I psychologically? Perhaps do I need to take a break? Perhaps even in the workplace, that 1 hour that maybe the organization tells you this is lunchtime, how you can still do some self-care in that 1 hour. Maybe you can listen to music, maybe you can do something that you like. Some people do drawing, some people do other personal. You have a personal time. Remember, in organizations there's so much vibe and social interactions. Some people might actually do well with just disengaging from the group and having some me time. Yes.
And now that you've mentioned the organization, I'm starting to wonder, does the organization or the employer in this situation play a specific role when it comes to this? Antipas?
Thank you, Stella. And maybe if I can take us back, you've talked about adopting measures that are more proactive rather than reactive. And when it comes to these interventions, we say that the earlier the better. Mzungu alisema kukinga ni bora kuliko kutibu. So we'd rather focus on preventive measures rather than rush to put in place curative measures. And most of these conditions that we are talking about, addiction being one of them, are chronic illnesses. So we may want to have programs or policies that are active in the workplace and in all of these professions, because we say everyone is at risk. And with a program such as employment assistance programs, we have programs in it that actually enable the employer to identify, to come in and assist, yeah, as early as possible, because you see, early intervention is key. It offers a chance for better clinical outcomes. So if we can have probably psychologists who are professionals, they can be able to do an early diagnosis or even do a basic screening and see if there is a presence or absence of a condition, and then immediately we have plans to have this person seek treatment, and also with constant probably psychoeducation, because again, knowledge is power, or information is power. If you know I'm feeling in this kind of a thing, you don't need to just step aside and say I'm not understanding what is going on in my life and all that. You know, I can actually get some help. You approach such a person because they're professionals. I know they can guide accordingly. Yeah.
Perhaps to continue with that conversation, where he says knowledge is power, is one of the other reasons why the retreat is doing such kinds of conversations, because we need to actually educate the public on some of these things, because now there are certain professions that are stigmatized when we talk about addiction. This is why we'll hear certain conversations that police officers, for example, they'll be very much focused on when there's an issue of addiction. Doctors, they are the ones who are supposed to have the knowledge in medicine, yet they are also in addiction. So there's a lot of stigma around that. So the other thing we can do is educate, which we are doing currently, hoping that now the general public can also get into the conversation.
Maybe to just focus on the organization, what organizations can do. It is also important now for the employer to provide medical covers that can really cater for the psychological needs of the employees, so that if a person is probably assessed and by the psychologist and found to actually need a psychiatric intervention, then the employer, by covering that with a medical cover, you have really assisted this employee to ensure that they are not further affected now by the financial cost of meeting treatment that may have actually been contributed to by the work duties that you have assigned to them.
Because I can only imagine you're already struggling with that stress of your own personal issues, and then on top of that, now the bills to try and take care of that stress. Having a cover would definitely be helpful.
And this is where we also say that instead of punishing such behaviors of addictions, because there are certain professions that do not actually understand the whole issue of mental health. Instead of punishing, we take whatever we are saying, the proactive way of actually trying to find treatment for it, rather than punishing the individuals involved in the whole.
Yeah, and probably if I can add a little from what Cook was talked about, you find that with these early interventions, he talked about work culture, organizational culture. You find that even in terms of output, productivity at work. So if you're able to address some of these issues as early as they arise, even productivity at the end of the day will be improved. Yeah. Come to matters insurance or health covers. You find these it should be easily accessible and it should be affordable. So if you find that with the early interventions, you minimize actually the number of people who will be utilizing this cover, because as early as possible you take this person in treatment, you reduce the numbers of the people who will be frequenting the hospitals, because probably the intervention was very late, so the level of morbidity was maybe severe. And if it had been addressed while it was moderate or mild, then it wouldn't have escalated to such a point. Yeah.
This has been a very fruitful conversation. I think it's helped. Again, the purpose of these episodes is to empower the public with this information. And I think it's very important that we shed light where there's stigma, so that people don't now approach, huyu anakuanga hivyo, kwanza mengi huko ni kubaya, so that people actually have that mind frame coming in, like anyone is at risk, doesn't matter the profession. But I like the aspect of being proactive. So today, take a look at yourself. Ask yourself what you can be doing to take care of yourself in whatever profession you're in. For those who are in positions of power, perhaps look at how you can take care of your employees at the same time. See what talks you can have with your people. See what if you can bring on a psychologist to psychoeducate your people, so on and so forth. The channels are very many. For those of you who may have questions, comments, concerns, feel free to engage with us on our social media platforms as listed below. Thank you very much.